Alright, let's go over some general care for mice. Mice are housed in a solid bottom shoebox cage with wire lids. Water is available all the time. Food, usually getting 12 to 18 grams of food for every 100 grams for the animal body weight throughout the day in small meals. You usually want their bedding to be soft, absorbent, dust-free, and non-toxic bedding. Enrichment includes things to climb on, hay, extra bedding, etc. Identifying mice in a clinic would be with a cage card. Other ways you can do that are with markings, tattoos, microchips, ear punchings, etc. You're always going to want to use gloves, and usually use the base of the tail and the scruff, which I went over earlier when I had my mouse. As far as looking for signs of disease, usually unkept appearance is the first thing you want to look for. That's the first sign. And then other signs are a temperature. You want to check pulse, respiration rate, discharge from eyes, ears, and nares, color of the mucous membranes, and the condition of the teeth. Body condition as results of palpation, and checking on the abdominal cavity are all on the list. Little anesthesia tidbits. Make sure they're out enough. Whiskers and ears in response to a puff of air. So if there's any response to you blowing on them, that means they're not out enough. You can also pinch them, pinch their foot or their tail. Minimum response is obviously good, means they're out. Respiratory rate less than 60 breaths a minute indicates dangerous central nervous system depression. And then you also want to check on temperature of a mouse. Ways to knock them out, usually a mask like one that you'd use on a dog. You can just cover them entirely and use isoflurane to knock them out. There are other masks that can just go over their face, but usually just using a dog one is good.